Assalamualaikum everyone. My name is Dr. Dileep Kumar and I am lecturer at Indus University, Department of Physical Therapy and Rehabilitation Sciences, Indus University. This series named as Anatomy Tutorial Series is basically launched by our respected chairperson Dr. Okasha Anjum, and she is a chairperson at Department of Physical Therapy, Indus University. The ultimate purpose of this series is basically to introduce you the basic anatomy concepts, the basic anatomy labs from the platform of Indus University, and to introduce the different anatomy tutorial videos in a very easy language. So let's start. Today our topic is the clavicle bone, as you all can see. So firstly, let's check the some landmarks of clavicle bone. What is the clavicle bone, where it lies, and what are the bony landmarks of the clavicle bone, and then we will make another video on the muscular and different attachments over the clavicle bone. So let's start. Let's have a look to the clavicle bone. First of all, what is the clavicle bone? Clavicle bone is also called the collar bone. It's also called the beauty bone. Here you can see these are the two are the clavicle bones. This clavicle bone is also called the collar bones that lies at the in front of the root of the neck. All you can see, you can easily palpate your clavicles also. So this one is the right clavicle and this one is the left clavicle. So clavicle lies at the front of the root of the neck firstly. Secondly, the clavicle is only bone that lies horizontally. If you go, if you look at the other bones, they are lying the vertical in direction, but the only bone that lies, this is the horizontal. Here you can see, this is the horizontal placement and this is the vertical placement. So the only bone that lies horizontally. Let's start with the clavicle bone, as we have already introduced the clavicle bone. Let me show you what are the phases or in which parts the clavicle is basically divided. So as you see, this is the clavicle bone and this one is your right side. So this is the right clavicle bone and this is the left clavicle bone. The left clavicle, if you can see the left clavicle bone, there are some red and blue markings. The red markings are indicating to the origins of the different muscles that we will study. When you talk about the, if you can see the blue, some blue markings are there, they indicate the insertions of the muscles. The origin, the red marking and the blue insertion, these are basically the attachments. The first attachment of a muscle is called the origin, which is here indicated by the red one, while the second attachment is called the insertion, which is here, it is indicated by the blue one. Well, we are talking about the bony landmarks. We will see the muscles and other attachments on another video. Okay, if you talk about the clavicle bone, it is basically divided into the three phases. The firstly, if I target, this is called the lateral end. This part is the lateral end, or also called the acromial end. Why this is called acromial end? Because it forms or it articulates with the acromion process of the scapula to form the acromioclavicular joint. I repeat, this is the whole clavicle. If you divide this is the right clavicle. If I show you thoroughly, here you can see. So if whole clavicle bone, this is the whole clavicle bone, you need to divide it into the three phases. The first part, this is called the lateral. This is the lateral aspect and this is the medial aspect. So this is the lateral aspect, the lateral 1/3. This end is also called the acromial end because it articulates with your acromion process of the scapula to form the acromioclavicular joint. When you talk about the medial one, this is the medial side. So lateral 1/3 and then you have a medial 2/3. The medial one articulates with the manubrium of the sterni to form the sternoclavicular joint. Let me show you on the skeletal. This is the lateral end which articulates with the acromion. This is the acromion process of, if I turn the skeletal, this is the acromion process of the scapula and it articulates with the acromial end to form the acromioclavicular joint. And then coming toward the medial aspect, this is the, here you can see, this hole is the chest bone. When you study the axial skeletal, this hole is the chest bone. The upper part is called the manubrium and this one is the body of the sternum, and this small part is the xiphoid process. When I talk, but we are not going on to the sternum bone, just come on the manubrium of the sterni. This manubrium has one landmark which is called the sternal notch that articulate with the clavicle. This articulate with the clavicle in order to form sternoclavicular joint. So this whole joint is the sternoclavicular joint. So we are not going into the joints basically. This articulation between the medial end of the clavicle, the external notch of the manubra and the first costal cartilage, they collectively form a sternoclavicular joint. Now if I talk about only the acromial lateral end, it has two surfaces. The one you can see from the above is the superior surface. If you talk about when you can see from the above is the superior surface. Here if I bring the anterior perspective, this is the superior surface, and the below you have an inferior surface. So let me demonstrate on it. If you talk about the lateral end of clavicle, it has one superior surface, it has one inferior surface. It means it has two surfaces. The one is the above and one is the below. If you talk about the borders, it has also two borders. The one which you can see from your front, the one which you can see from the front is the anterior border, which is, if you can see, this is the anterior border, which is concave having some sort of the cavity, and other aspect the posterior border, which is convex. So if I talk about, it has two surfaces, the superior one and the inferior one, right, and it has two borders, the anterior border and on posterior border on the posterior side. So it has two surfaces and the two borders. If you see, the superior surface is some sort of the rough, which is subcutaneous. When you talk about the inferior surface, it has some tubercles. Let me show you how. So this is the superior surface, which is quite subcutaneous, and when you talk about the inferior surface, it has some ridges, tubercles. It has some tubercles. This tubercle, if you can see, if I mark with the pencil, this is conoid tubercle, and this what we can say, the rough lines, these are called the trapezoid lines or trapezoid tubercles. Tubercles means when there is some sort of the rigid or speed breaker type structure. So these are the conoid. Why they are called conoid? Because they give attachment to the conoid part of the coracoclavicular ligament. The coracoclavicular, the ligament between the, we know that the ligament connects the two structures with especially the bones. So coracoclavicular ligament, it comes from the coracoid process toward the clavicle. So these are the two ligaments. It has two parts. Coracoclavicular ligament has basically two parts. The one is the conoid and one has the trapezoids. So conoid ligament gives attachment here, and they another aspect attached to the coracoid process. And these trapezoids line, they also attach the trapezoid part of the coracoclavicular ligament, and other part of this ligament would be on the coracoid process of the scapula. And when you talk about the border, these articulate with the acromion process of scapula and also gives attachment to the capsular ligaments, also gives attachment to the acromioclavicular ligaments in order to stabilize the acromioclavicular joint. Okay, so now if we talk about the shaft, the acromial end or the lateral end is almost clear. Now if you talk about the shaft of the what we can say, the mid shaft of the clavicle bone, this is the shaft of the clavicle bone. It has some rough surfaces and it has also the smooth surfaces. We will talk about it. When you talk about the lateral 1/3, this part is the lateral 1/3, and this whole part is the medial 2/3. Medial 2/3 is quite larger rather than the lateral one. And when you if you get confusion in as I told you about the conoid and tubercle, which one is the medial? If you talk about the conoid ligament is medial rather than the trapezoid. So if you come from the medial perspective, you will feel the conoid tubercle first, and then you will feel the trapezoid's line. So conoid tubercle is around about 4 to 5 centimeter away from the lateral end of the clavicle, while the trapezoid ridges line, what we can say the rough lines, they are 3 centimeters away from the lateral end. Okay, so this was about the lateral end of the clavicle. Now we talk about this is the shaft. This is the shaft of the clavicle, and this is the medial end. This is the medial end. The medial end has 4 surfaces. The one surface which you can see from the front like this is the anterior surface. Here you can see, here are some muscles attached, but we will talk in other aspect. If you can see, this is the anterior surface, and one it has the superior surface. If you talk about the anterior surface, this hole is the, if I mark with the pencil, this anterior surface gives attachment to the pec major muscle, our pec major muscle, which is which comes from the, which gets attachment from the hair, from the sternum, and then this is how the main pec major we will see on the muscular skeletal muscular model. Then you talk about the superior surface, the just above it we have a superior surface. The medial aspect, if I mark with the pencil, the medial end, yeah, or what we can say, the medial aspect of the superior surface of the clavicle bone gives attachment to the sternocleidomastoid. If we will see the muscle sternocleidomastoid. So the clavicle part of the sternocleidomastoid SCM, which is commonly called the SCM muscle, the clavicular part gets attachment here on the superior surface, the medial border of the medial half of the superior border. Then if I show you on this, here you can see, okay, so this surface is the anterior surface, which gives attachment to the pectoralis major muscle, the pectoralis clavicular part of the pectoralis major muscle. This is the superior surface, this part gets attachment. So it has basically the four surfaces, the anterior surface, and then you have a superior surface, then you have a posterior surface which also gives attachment to the sternohyoid coming from the sternum to hyoid bone, okay? And then finally you have an inferior surface. There are some special inferior means down, so it is also the inferior aspect we will see. On the medial 2/3 we have also an inferior surface. There are some special landmarks on the inferior surface. If I show you on this, okay, this is your inferior surface. So here you can see there are some this groove, if I mark with the pencil, this groove is called the subclavian groove. So the name itself is indicating here is the attachment of the subclavius muscle. Here this groove is called the subclavian groove, and this groove has two lips. If you can see, these lips are the outer lip or inner lip. It has two, basically you can see the lips as a margin. So it has two margins, basically the outer one and the inner one. They give attachment to clavipectoral fascia. There is a fascia which are between the clavicle and the pectoralis. So that fascia gets attachment from the margin of these lips, the outer lip and inner lip. And then when you come toward the laterally toward this side, you will feel here as a foramen. This foramen is the nutrient foramen. So in inferior surface there are the special three points that you need to be for a viva or clinical perspective: the subclavian groove which gives attachment to the subclavius muscle, and then you will find a nutrient foramen at the lateral margin of the subclavian groove, and then you will find the outer and inner lips or outer and inner margins of the what we can say the subclavian groove, which gives attachment to the clavipectoral fascia. So this was all about the surfaces. You have four surfaces: the anterior surface, the superior surface, the inferior surface, and then you have a posterior surface. The all are connecting with they give some sort of the attachment. Like if you talk about the acromial end, it has anterior border which has a deltoid tubercle. So the name itself indicating it will give attachment to the deltoid muscle. If you talk about the posterior border, this is the posterior border that gives insertion to the trapezius muscle. If you talk about the inferior surface, it has subclavian groove, as we already discussed. It gives attachment to the origin to the subclavian muscle. When you talk about the anterior surface, it gives attachment to the pectoralis major. When you talk about the superior surface, it gives attachment to the sternocleidomastoid. When you talk about the posterior surface, it gives attachment to the sternohyoid. So if I show you on the muscular and ligaments attachment, here I need to move on the left side. So if I turn this skeletal little bit, okay, now here is the mask just because of the COVID condition. So that's a sign. There's a sign basically, as we already discussed about the bony landmarks. Now let me show you some muscular attachment. As I have already told you, the red marking indicate to the origin, and while the blue marking indicate to the insertion of the muscles. Now what are the muscles attached here, what are the muscles gets origin here, and what muscles get insertion from here. Let's have a look. So as I have already mentioned you, now this is your left side. So we need the left clavicle. This is your left clavicle. Okay, okay, you can see. So this would be your lateral end or the acromial end, and this is your medial end or sternal end. Okay, let me show you the. If you can see, there are the three red marks: the 1, 2, and 3. I will tell you what are these. The 4 and there is the one blue. Okay, so if you talk about the medial perspective, this is the anterior border. So if you can see, this is the anterior surface of the medial end. It gives attachment to the pectoralis major. So this one is the pec major, pectoralis major. Then you talk about the superior one. This is the superior one, superior surface of the medial end. So this will, the medial half of will give attachment to the sternocleidomastoid, the clavicular part of the sternocleidomastoid. Okay. Then finally, if you see on the posterior surface, the above all both landmarks, if you can see that this landmark, this one, this is the sternocleidomastoid. Just to show you, not they are like somehow like looking like the arrangement is not like this, but in order to just demonstrate you, this is the pec major, the first one, and here you can see this one is the sternocleidomastoid, the clavicular part, and then you have a sternocleidomastoid muscle. Now coming toward the lateral perspective, this is the anterior border of the acromial end. So this is the deltoid tubercle, and it gives origin to the deltoid muscle. As you see on its back, here you can see this blue landmark. If I turn around, okay, if I turn around here, you can see the blue aspect is gives it indicates to the insertion of the trapezius muscle. So this is the posterior border which is filled from the which gives insertion to the trapezius muscle. Okay, so these were the muscles. Now let me demonstrate it on the. As you all can see, this is the sternum. So this is the sternum, and this part, this whole part connecting with the two ribs, the first rib and the second rib, this is the manubrium of the sterni. This is the body of the sterni starting with the 3-1, and this small part is the xiphoid process. All you can see here, this is the manubrium of sterni, this is the body, and this is the xiphoid process. So if you talk about, we are only focusing on the manubrium of the sterni. If you see on the manubrium, here is the attachment of the first costal, and this part which is called sternal notch, this part, sternal notch, here the clavicle articulates. If I let me show you. Okay, this is the left one and this is your right one. Okay, here the clavicle basically articulates. Here the clavicle articulates to form the, this is your right, and let me show you, this one is your left. Here it gets attachment. Here it gets attachment to form the left sternoclavicular, and here it gets attachment to form the right sternoclavicular joint. As we have already discussed about the clavicle and its bony landmarks, let's have a look to the muscles which are attached on the clavicle, which are getting the origin from the clavicle or which are inserted over the clavicle. As we have already seen about the clavicle, okay, let me make it more simple. This one is the medial aspect, this part is the medial aspect of the clavicle, and this is your lateral aspect. As I have already demonstrated, this one is the medial aspect and this is the lateral or acromial. This medial, the sternal, okay. This is the sternoclavicular joint. So here is the left one, left sternoclavicular, and here is your right sternoclavicular. Here it is the here must be the right acromioclavicular. Here you all can see the left acromioclavicular. Okay, so we are focusing on the left one. This is the left clavicle. If you talk about the medial aspect, we have already seen there are the 4 surfaces on the medial side of the medial end of the clavicle. The number 1, you have an anterior, which you can which you see from the front. Okay, if you see the anterior border gives attachment to the main muscle. Okay, as we have removed the pectoralis major, here the small muscle you can see number 97. This one is the pectoral spinal muscle. The anterior surface, as I demonstrated on the skeletal also, this anterior surface is giving origin to the major muscle. Now if you see on the superior surface, here a long muscle this way, this long muscle is the sternocleidomastoid. It's getting origin from the 2 points. Why this is called the sternoclavicular mastoid? Because it has 2 ends, the sternal end, this one, this getting origin from the sternum, the manubrium of the sterni, and this is the clavicular part which is getting origin from the clavicle. Simple as that. So sternocleidomastoid, always it is inserted over the mastoid process. Here you can see always it is inserted to the mastoid process. So this muscle, basically ACM, is getting origin from the sternum. If I make 2 fingers like this, the sternal end and the clavicular end, and always they are coming upward to be inserted on the mastoid process. So this muscle is the sternocleidomastoid. So the superior surface is giving origin to the clavicular part of the ACM, sternocleidomastoid. Let me remove this muscle also. As we have already removed the sternocleidomastoid, now if I remove the clavicle bone, here you can see the superior surface which was giving origin to the clavicular part of the ACM. Now if you talk about the posterior aspect on the clavicle, like if this is your left clavicle, so you are talking about the posterior aspect. If I show you, this would be the posterior aspect. This gives origin to a muscle which we call it sternohyoid muscle. Now this one is the superior surface, and this was the anterior surface, and then you have an inferior surface. So let me remove. If I remove the clavicle bone, here you can see the inferior surface. This red structure is the subclavius muscle. So where it is attached on the subclavian groove. Let me show you on this. If I show you the inferior, this is the subclavian groove which has 2 lips, the outer one and the inner one that I have already demonstrated. So this groove is getting attachment from the subclavius muscle. This muscle is as you can see the number in mentioned 29. This muscle is the subclavius muscle which depresses the clavicle during the shock absorption or overhead movements. Now coming toward, if I place it back to its position, okay, now coming toward the lateral aspect, if I show you, the laterally and the acromial end has the superior surface. This one is the superior surface which is quite subcutaneous, and then you have the inferior surface, okay, and it has 2 borders, the anterior one and then you have a posterior border. This anterior border has the tubercle, the name itself indicating it gives origin to the deltoid muscle. This hallway muscle, this long triangular muscle is your deltoid muscle. If I remove this muscle, this muscle is the deltoid. This one is the deltoid which has anterior fiber, middle and the posterior fibers. Okay, this whole muscle was getting origin from the anterior border of the acromial end of the clavicle. Now if we talk about the posterior aspect, the posterior border is also getting the attachment, the insertion of which muscle? This hallway muscle. If I show you, this is the trapezius muscle, all way coming from the cervical, is getting the insertion over the clavicle and the spina scapula also. Okay, this whole long way muscle is basically the trapezius. Anterior border giving origin to the deltoid, the posterior border giving insertion to the trapezius muscle, and then it has the superior surface which is the subcutaneous, and it has the inferior surface. On inferior surface we have 2 tubercles, the conoid, and then you have a trapezoid lines. Let me show you. Okay, if you focus on this, on the inferior surface you have this structure. This is the conoid tubercle, and these lines, if I mark with the pencil, these are the trapezoid lines. The conoid tubercle gives attachment to the conoid part of the coracoclavicular ligament, while the trapezoid line gives attachment to the trapezoid part of the coracoclavicular ligament. So the coracoclavicular the two ligaments coming from the coracoid process, basically connecting the ligament connects the bone to bone, connecting the two bones basically. So coracoclavicular ligament, there are the two ligaments all way coming from the coracoid process of the scapula, and they are getting attachment here. So conoid is more medial one, conoid is the more medial one, and it is 4 to 5 centimeter away from the lateral end, and the trapezoids line is basically 3 centimeters away from the lateral end. So conoid is more medial rather than the trapezoids lines are lateral. Okay, let me show you. Okay, this one is your right aspect. So if you see if I focus on the acromial end, this is your acromial end and this is your sternal end. This is the superior surface, and now if you focus on the inferior surface, okay. If you talk about the scapula, this is the acromion process, this is the coracoid process, always like a finger, always like a finger. So the ligaments coming from the two ligaments, one is the medial one which is the conoid, and one is coming which is the lateral is the trapezoid. So they all way coming from the inferior surface. Okay, from this one the conoid coming from this way and attached to the coronoid process of scapula, and the trapezoids like this one and getting attached toward the coracoid process of scapula. So thank you so much. This was all about the clavicle.